Hey there newcomers. So actually I am Abhishek and I will be teaching every anatomy topic in detail. If you like the video, you can always consider subscribing. So today we are going to discuss about the anatomy of the obturator nerve. So actually obturator nerve is the chief nerve of the adductor compartment of the thigh, that you always need to know. It is the chief nerve of the adductor compartment of the thigh. Chief nerve of the adductor compartment of the thigh. And where does it arise from? It arises from the lumbar plexus in the abdomen. Arises from the lumbar plexus in the abdomen. We have complete anatomy of the lumbar plexus of abdomen. You can make sure to watch that. Arises from the lumbar plexus in the abdomen, and it is found by the ventral division of the anterior primary rami of L2, L3 and L4. We have L2, L3 and L4 combining by the anterior primary rami of these spinal nerves. So, L2, L3 and L4 anterior primary rami. Anterior primary rami of spinal nerves from the L2, L3 and L4, it arises into the obturator nerve. So, this is the obturator nerve. So, what about the course and distribution of the obturator nerve? While passing through the obturator canal, the obturator nerve actually divides into the anterior and the posterior divisions. When does it divide? While passing through the obturator canal. So, actually it divides into the anterior and the posterior divisions. This is the anterior division and this is the posterior division. So, when it comes to anterior division, the anterior division will pass downwards into the in front of the obturator externus muscle, and afterwards it will descend behind the pectineus muscle and also the adductor longus muscle, and then it will supply pectineus, adductor longus, gracilis as well as adductor brevis. So, anterior division will supply the pectineus, adductor longus, adductor brevis as well as gracilis. So, these are the four different muscles that is supplied by the anterior division. So, the anterior division also gives an articular trip to the hip joint as well. So, small branch it will give to the hip joint. So, it is also supplying a hip joint. So, distal to the adductor longus, it enters the adductor canal where it also provides a tweak to the subsartorial plexus of nerves. It also supplies the subsartorial plexus of nerves, a small branch. And then it will terminate by supplying the femoral artery in the adductor canal. It will terminate by supplying the femoral artery in the adductor canal. That's about the anterior division of the obturator nerve. So, what about the posterior division? The posterior division will enter the thigh by piercing the anterior part of the obturator externus muscle, and afterwards it will descend down to supply the three different muscles. They are the obturator externus, adductor magnus and adductor brevis. It supplies the obturator externus, adductor magnus and also adductor brevis. Remember, only adductor brevis has both anterior and the posterior division supply of the obturator nerve, and also its terminal part will form an articular branch called as the genicular branch. Genicular branch, that is the terminal branch of the posterior division of the obturator nerve. Genicular branch, it pierces the adductor magnus and passes in front of the femoral vessels to reach the popliteal fossa, where it runs along the popliteal vessels, and also it pierces the oblique popliteal ligament to supply the knee joint. This genicular branch will also supply the knee joint. So, whereas this branch will supply the hip joint. So, that is about the individual supply of nerves of both the anterior and the posterior division of the obturator nerve. So, some clinically what you need to know, when it comes to the adductor spasm of the thigh, that is the spasm of the adductors of the thigh, that is known as the spastic paraplegia. Spastic paraplegia, which may be relieved by surgical division of the obturator nerve. So, that is the adductor spasm of the thigh, that is known as the spastic paraplegia. It is relieved by surgical division of the obturator nerve. And also we have something called as the referred pain. So, actually in diseases of the knee joint, the pain may be referred to the hip joint along the obturator nerve. If you have the knee joint pain, sometimes it is also referred to the hip joint because of its referred pain, that is the supply of both the knee joint and the hip joint by the obturator nerve as well. So, that is about some of the clinical significance of the obturator nerve. There is another small topic that you need to know, that is something called as the accessory obturator nerve. Accessory obturator nerve. So what is so special about the accessory obturator nerve? So it is present in only about 30% of the individuals. Accessory obturator nerve is present only in about 30% of the individuals, and it also arises from lumbar plexus, but it is only by the ventral division of the anterior primary rami of the L3 and L4 only. The accessory obturator nerve arises from only L3 and the L4, but when it comes to the anterior division, it's obturator nerve. The same when it comes to the posterior division of the L2, L3 and L4, it goes to the femoral nerve. So actually it crosses the superior ramus of the pubis, that is the accessory obturator nerve, and then where it supplies the pectineus muscle. It also gives the articulator to the hip joint as well. If the accessory obturator nerve is very small, it will supply only the pectineus muscle. So this is about the anatomy of the obturator nerve in terms of its the divisions and what are the things that is going to supply, and what does it cause if it is damaged. So thank you guys, thank you for watching. If you have any comments or suggestions on the video, it can always comment it down, and thank you for watching and share it to your other friends.